Aha!
Warm welcome to all. Me myself Rahul is here to give you a small introduction on World Hepatitis Day. Hepatitis can't wait. Yes, 28th July, World Hepatitis Day. It is an opportunity to step up national and international efforts on preventing hepatitis and a need for greater global response. But wait, what is really hepatitis?
That's a very significant question, Rahul. Worldwide, about 300 million people have been infected with viral hepatitis, even without knowing that they have been affected with the virus. Speaking about the Indian scenario, we have about 40 million people infected with viral hepatitis B, constituting about 11% of the estimated global patients. Sad, isn't it?
Yes, it is heartbreaking. By the way, hepatitis refers to an inflammatory condition of the liver in which it gradually damages its functioning. It's mainly caused by viral infections or occurs as a secondary result of medications, drugs, toxins and alcohol. And it is very interesting to note that there are different types of hepatitis including hepatitis A, B, C, D and E, in which some are acute and some are chronic in nature.
Oh, that's a huge number. By the way, what's the difference between them?
Yes, you're right, Liana. Each viral hepatitis is different in its own way. Hepatitis A is an acute and short-term disease, while hepatitis B, C and D are ongoing and chronic. Hepatitis E is usually an acute disease but can be dangerous, particularly in pregnant women. Now let us look into each of these viral diseases one by one. Hepatitis A. It is an infection caused by hepatitis A virus. It can be transmitted from one person to another through food and water contaminated with feces of an HIV-infected person. Hepatitis B. This infection can be caused due to contact with body fluids like blood, vaginal secretions and semen of people infected with hepatitis B virus or HBV. Injection drug use, unprotected coitus, sharing of razor blade can increase the risk of causing this disease, that is HBV or hepatitis B virus.
Hepatitis C. Hepatitis C comes from the hepatitis C virus, HCV. It is mainly transmitted through infected body fluids, typically injection drug use or sexual contact. It is among the most common blood-borne viral infection in the world. Hepatitis D, also known as delta hepatitis, is a serious liver disease caused by the hepatitis D virus, HDV. It is mainly contracted through infected blood. It is a rare form of hepatitis that occurs only in conjunction with the hepatitis B virus because the hepatitis D virus cannot multiply without the presence of the hepatitis B virus. Hepatitis E. It is a serious waterborne disease mainly found in areas with poor sanitation caused by the hepatitis E virus, HEV. It is typically resulting from ingesting fecal matter that contaminates the water and food supply.
Transmission can include the receipt of contaminated blood or other blood products, the sharing of used syringe or other equipments, and from mother to a child at birth and or even by the sexual contact.
Diagnosis of hepatitis. When talking about diseases, the diagnosis is very important.
blood tests are used to look for signs that a viral infection is present and to evaluate liver function. The result of a blood test can be confirm the type of viral hepatitis, the severity of the infection, whether an infection is active or dormant, and whether a person is currently contagious. A blood test can also confirm whether a virus is acute or chronic. If the result of the blood test confirm a diagnosis of viral hepatitis, your doctor may recommend imaging tests or a liver biopsy to determine the extent of liver disease.
After the diagnosis, the medication should be started without any delay. For some hepatitis, it gets cured upon itself within a particular period of time. For example, hepatitis A takes up to 1 to 2 months, whereas hepatitis E just takes 4 to 6 weeks. The treatment mainly relies in arrest, rehydration, supportive care, and stoppage of alcoholic use. When detected early, autoimmune hepatitis can be cured by drugs that suppress the immunity system. For alcoholic hepatitis, stoppage of alcohol use and intake of some steroid drugs may help. For hepatitis C, antiviral medication should be helpful. 25% of people suffering from chronic hepatitis B can be cured by a drug called pegylated interferon alpha, which is taken as a weekly injection for 6 months. In some serious cases, a liver transplant is also recommended.
That was the medication for hepatitis in modern medicine. Now, do you know that it has medication in the ancient Indian medicine or Ayurveda? Yes, definitely. In Ayurveda, the treatment for hepatitis includes Shodhana Chikitsa or detoxification through Panchakarma, Shamana Chikitsa, palliative Ayurvedic medicine, Kaya Kalpa or rejuvenation, and strict diet of bitter herbs and changed lifestyle. These medications can increase the chances of a patient recovering from hepatitis.
Yes, definitely. People with these diseases have to take special care of themselves. Information suggests that people who have been living with hepatitis B and C for some time and people who have developed advanced liver diseases would be in greater risk if they have tested positive to COVID-19. If you are currently taking any treatment for hepatitis or other chronic diseases, it is recommended to ensure that you have adequate stock of your medication to avoid visits to health services or pharmacies.
Since this is such a complicated disease, I hope there will be some preventive measures. Can Jeez tell me about that?
Washing the hands carefully after using the bathroom and before eating. Ensuring that food is fully cooked and appropriately stored. Drinking only bottled waters when traveling. Avoiding or peeling fruits and vegetables that may have been washed or grown in contaminated water. A person may wish to ask their doctor about the hepatitis A vaccine, especially if they are traveling to an area where the virus is prevalent.
By the way, does this show any sort of specific symptoms like other diseases?
There are so many symptoms for this, but the interesting fact is that the hepatitis signs and symptoms do not even appear at all if you have had the virus for a few weeks. But for some, they do not appear at all. But if you do, the symptoms may contain fatigue, sudden nausea or vomiting, abdominal pain, or even discomfort that can appear on the right side of your breasts, dark urine, low-grade fever, intestine itching, etc. It can also have severe cold or fever for few months.
Now I understand, but it's too complicated.
Diseases are man-made. We bring them upon us. But nature is abundant with remedies that can treat most of our ailments. With the right diet and nature's healing remedies in the form of plants and herbs, and to prevent diseases like hepatitis.
So let's all join our hands and fight against hepatitis.
As we all know,
Hepatitis. Can't wait.
Hi, my name is Eric Chase. I study in Standard 6B of Nirmala Matha Central School. World Hepatitis Day aims to raise awareness of hepatitis. Hepatitis is a group of infectious diseases that comes in many types. World Hepatitis Day aims to encourage prevention, treatment, and diagnosis of hepatitis. Hepatitis means inflammation of the liver. The liver is a vital organ that processes nutrients and fights infectious diseases. If the liver gets inflamed or damaged, its functions can be affected. The symptoms of hepatitis includes fever, fatigue, vomiting, loss of appetite, jaundice, and joint pain. However, we can prevent hepatitis using the hepatitis vaccine that is recommended for all infants at birth and for children under the age of 18. It is also recommended for adults with diabetes. The vaccine makes us fully immune from hepatitis. Thank you.
Hi all. Do you guys know about the importance of 28th July? We, students of class 12A, are here to create awareness about the topic World Hepatitis Day. World Hepatitis Day is commemorated each year on 28th July to enhance awareness of viral hepatitis and inflammation of liver that causes severe liver disease and cancer. Hepatitis affects millions of people worldwide, causing acute and chronic disease and killing close to 1.34 million people each year. With a person dying every 30 seconds from a hepatitis-related illness, even in this current COVID-19 crisis, we can't wait to act on viral hepatitis. Let's know more about this.
World Hepatitis Day is observed every year on 28th of July to spread awareness against the viral disease hepatitis. It causes inflammation of the liver and hepatocellular cancer. The theme for this year is Hepatitis Can't Wait. With a person dying every 30 seconds of hepatitis-related illness, we just can't wait to act to eliminate this disease as a public health threat.
Hepatitis A is a viral liver disease caused by hepatitis A virus. It spreads when an unvaccinated person ingests food or water contaminated with feces of an infected person. It is closely associated with improper hygiene, drinking of unsafe water, and inadequate sanitation. Hepatitis A, when compared with hepatitis B and C, does not cause chronic liver disease and is rarely fatal. Almost everyone recovers from this fully and with lifelong immunity. However, a small proportion of people can die from fulminant hepatitis or acute liver failure. Symptoms of the disease can include fever, fatigue, loss of appetite, jaundice, and abdominal discomfort. Diagnosis of hepatitis A is by detection of HIV-specific immunoglobulin G or IgM antibodies in the blood. The most effective way of preventing hepatitis A is by improved food quality and immunization.
Hepatitis B. Hepatitis B is a viral infection that causes the inflammation of the liver. When the illness occurs, the disease is either acute or chronic. The acute hepatitis virus is a mild disease from which most people will recover. The chronic form of hepatitis virus is more serious and can lead to complications such as liver fibrosis, liver cirrhosis, liver failure, and liver cancer. The hepatitis is caused from person to person through body fluids and blood. The transmission may be caused by various means, including infected blood or other body fluids coming in contact with cut and scratches, sexual contact, sharing of personal items such as toothbrushes from a mother to her unborn baby, sharing of needles and syringes. The symptoms of hepatitis virus include fatigue, fever, jaundice, weight loss, nausea, and vomiting. There is no cure for acute hepatitis B. Treatment for it can be given within 24 hours to 1 week of exposure to the virus. Injections of hepatitis B specific immunoglobulin can be given to the patient so that they will be developing antibodies to fight the hepatitis B virus. People with chronic hepatitis B should maintain a healthy diet and avoid alcohol and unnecessary medications. The serious liver complications of chronic hepatitis B can be prevented if it is detected and treated in the early stages. Vaccination is a safe and effective way of preventing the spread of hepatitis B.
Hepatitis C. Hepatitis C is a viral infection caused by the hepatitis C virus. This virus spreads through in contact with infected person's blood or body fluids. Today, most people become infected with hepatitis C virus by sharing needles or other unsterile equipment used to administer medications. Every chronic hepatitis infection starts with an acute phase. Acute hepatitis C usually goes undiagnosed because it rarely causes any symptoms. Chronic hepatitis C can often lead to liver disease and cirrhosis, which cause significant complications. Detection of hepatitis C virus includes blood testing for viral RNA. Currently, there is no vaccine for hepatitis C. People with chronic hepatitis C can often have no symptoms, and when the symptoms arise, they are often a stage of advanced liver disease. Getting tested for hepatitis C is important because treatments can cure most people with hepatitis C in the acute phase. The best way to prevent hepatitis C is by avoiding behaviors that cause and spread the disease.
blood test, liver ultrasound, and liver biopsy. Blood test. Blood test can detect signs of hepatitis B virus in your body and can tell your doctor whether it is acute or chronic. A simple blood test can also determine if you are immune to this condition. Liver ultrasound. A special ultrasound called transient elastography can show the amount of liver damage. The last method is liver biopsy. Doctor might leave a small sample of liver for testing to check for liver damage. During this test, doctor will insert a thin needle through your skin into your liver and removes a small sample for laboratory analysis. steps to create social awareness. Everyone should have the access to hepatitis prevention, testing and treatment services. All pregnant women should be routinely treated for hepatitis B. All newborns should be vaccinated for hepatitis B at birth. Timely testing and treatment of viral hepatitis can prevent liver cancer and other liver diseases. Expand access to testing and treatment for hepatitis B. Prevention is better than cure, so let us follow these steps and build up a healthy society. Thank you.
Alcoholic hepatitis is the inflammation of the liver caused by drinking alcohol. It affects the people who drink heavily for a long period of time. The symptoms of the alcoholic hepatitis is a yellowing of eyes, nausea, fever and vomiting. It slows down the blood flow in the liver and increases the pressure in the major blood veins, resulting in the building up of toxins. Complications also include enlarged vein, kidney failure and cirrhosis. Reduce the risk of alcoholic hepatitis by stop or reducing the drinking of alcohol. Check before mixing medication and alcohol. Thank you.
Treatment for hepatitis. Treatment for hepatitis differ according to the type and severity of the disease. Treatment for hepatitis A. Usually hepatitis A doesn't require treatment because it's a short-term illness. Bed rest may be recommended if symptoms cause a great deal of discomfort. Hepatitis A vaccine is available to prevent this infection to all age groups. Treatment for hepatitis B. Acute hepatitis B doesn't require specific treatment as it is cured over time. Chronic hepatitis B is treated with antiviral medications. This form of treatment can be costly because it must be continued for years. Treatment for chronic hepatitis B also requires regular medical evaluations and monitoring to determine if the virus is responding to the treatment. Vaccination is also available for hepatitis B. Treatment of hepatitis C. Antiviral medications are used to treat both acute and chronic forms of hepatitis C. People who develop chronic hepatitis C are typically treated with a combination of antiviral drug therapies. They may also need further testing to determine the best form of treatment. People who develop cirrhosis or liver disease as a result of chronic hepatitis C or B may undergo liver transplantation. Treatment for hepatitis D. Currently, there are no treatments available for hepatitis D. Chronic hepatitis D is usually treated with pegylated interferon, although other potential treatments are under study. Treatment for hepatitis E. Hepatitis E is a virus that infects your liver. Most people with hepatitis E get better automatically. Usually, it doesn't lead to long-term illness or liver damage like other forms of hepatitis. But hepatitis E can be dangerous for pregnant women or anyone with weak immune system, including elderly people.
We can spread awareness among people who are unaware of these stages. We can save lives. We can eliminate viral hepatitis from the planet. All we need to do is testing, early diagnosis, prevention and treatment. So let's make this world a better place for you and for me and the entire human race. Thank you.